respected Additional Chief Secretary, ma'am, Dr. Chandakumar, Dr. Ilan, Dr. Pachmuthu, and all the experts and speakers. Many of my friends are here. It's happy to see them here. I want to talk on what is happening of this digital innovations in the public health. So actually, for us, it's a part of the program. So once you understand what we do, how we can incorporate all those digital innovations within the system. See, the ultimate idea of the government putting the digital solutions into the program is that it should become more efficient. It should become more accessible. It should reach the people who are not reached. So either it could be an underserved area or underserved population, how we can reach. That's the ultimate goal. So you take one program, for example, we give rupees 18,000 as an maternal benefit to the mothers of Tamil Nadu. See, for this, we need to identify maybe from a pool of 10 lakh antenatal mothers who become pregnant in a year. We need to identify them with 12 criteria. And once you identify them, we need to give an installment basis based on the certain parameters. See, the first parameter is based on the receiving antenatal checkup. The second parameter may be based on the immunization. Based on this, we need to identify whether they are eligible for the installment. And once you've done it, we need to identify the source of funding. See, the source of funding, you all know, out of this 18,000, 5,000 is from Government of India in the ratio of 60-40, and remaining 13 is from the Government of Tamil Nadu. Within this, again, it need to get approved by an appropriate authority. For the Government of Tamil Nadu, it will get approval at the block level. For the Government of India, for 60-40, it need to get approved at the Women and Child Development Ministry. It's a different ministry from the health departments implementing it. And we need to push the data from one portal to another portal. And after that, once it is approved, we need to give this money from two sources. So one from the state nodal account where both Government of India and Government of Tamil Nadu puts money, and one from the Government of Treasury account where we need to move money. See, all these things should happen simultaneously, where the mother, for her, she will give the details to the VHN and the money should come into her through DBT to an account. See, for this simple process, all these options multiplication is possible. That too for 10 lakhs mother, only if you're able to do an digital interventions. So this is what exactly we do. For every DBT, we move through a PFMS account and money is reached. In the similar way, Chandra was talking about our insurance scheme with a small saying that only if you are able to get an NABL accreditation, you will get 10% more as a package. We could definitely bring more people into the system. The similar way, we developed this insurance totally an IT platform where more than 1.4 crore families are benefited and more than 1,200 hospitals are operating for more than 1,100 packages, where our pre-authorization approval and claim approval will happen within 24 hours. And our payment will happen, which is around 1,000 crores in a year, will happen within 7 days. See, all these are possible only because we move between the IT solutions where defined packages, predetermined conditions, verifying those eligibility factors and putting. In this way, we can go on talk many things. The another recent example is your COVID. We've given a COVID vaccination certificate using a COVID platform. In Tamil Nadu alone, we have given around 12.75 crore doses vaccine certification. Here also again, multiple beneficiary, multiple doses, different providers, single identification. In fact, this is given as a evidence, the COVID certificate across the globe, where even the developed countries still use the manual format. We could able to give it this. The similar one based on the knowledge of COVID, we are now in the process of adopting to the UWIN, where more than 9 lakhs children born in Tamil Nadu from birth to 16 years, all the vaccination will be tracked and given. This is the many interventions, but ultimately what our Niranjan was also mentioning 1 year, see, we are in the process of moving to the National Digital Mission. So where the 2 or 3 important things is that we need to identify every individual using an ABA ID. we need to identify every provider using a health facility registration and health personnel registrations. See, this includes all big players, small players, individual doctors, labs, everything. We are able to bring it, the so-called real data generation will happen. See, this is the way in which we need to take future purely based on the data-driven decision making. And for this one part, to make it happen, we have a HIMS version 3 now. We started almost 10 years back. We are again and again developing further. This HIMS 3 will have the major portals like how your registration will happen, how your doctor clinical prescription should happen, and how your lab information management should happen, and how your drug dispensing system happen. And finally, all your things will be given as a message to the beneficiary. This is already in pilot. This will get expanded throughout the country. And from now, the political impulsions were very clear that at any point of time, I should know what is the ARV or ASV, that is your anti-rabies vaccine, anti-snakes venom, available across more than 2,000 primary health centers at any point of time. See, this is all possible only because of your drug management system we operate across. The similar, another 2-3 things is your PIGMI portal, we call it, the pregnancy infant cohort monitoring, where we monitor more than 10 lakh mother, where it is facility service is given by across all the private and government institutions. And also, we could able to pick up at any point of time. Say, I can even very well clearly say, as on today, more than 5.6 lakhs mothers are there in Tamil Nadu, out of which maybe around 3.2 lakhs were risky mothers, which we categorize around 40 to 50 high-risk mothers, right, from your elderly, to teenage pregnancy or GDM, whatever it is. And to the extent that we can able to say, in this district, this ward or this village, this high-risk mother exists. See, this has facilitated us to track them very closely. Now, in fact, establish a call center to track them so that the definite intervention can be given. This is what ultimately leads to a reduction in your MMR, IMR. So this is the way you are going. And another real known example where Shamil also participant is your Makkale Thedi Maruthuvam, where we have a line list of nearly 1.8 crore non-communicable disease patients. I think no other state in the country will have this many line listed patients, where it's all numbers. Your line list, and after providing them a doorstep free medicines, we are going to the next level where she has intervened, where from the machine, the data can be moved into the portal directly. And next intervention will be your how to identify them, not only tracking them, how to manage them for a complication, how to identify those with the early complications, our next intervention. And another public health big intervention is your IHIP, we call Integrated Health Information Portal, where all those informations of the communicable diseases happening across the state we can able to capture, including if the public want to put it in the domain, that can be done. This will give an idea. In fact, we can even predict that this and all is going to happen in this particular districts, because we have one more layer added to it, where, for example, in dengue, by a mosquito surveillance, we can even predict that in another 2 to 3 weeks, we expect a small outbreak in this particular area or what. So this is all possible with IT. And finally, we are talking about telemedicine. At least in this difficult to access area, we have our eSanjeevani portal, where we continue to top across the country. And data visualization, as pointed out by many speakers, is very much essential. In fact, research on this data visualization, data sharing, data-based decisions, very much essential. Unless you have this data, nothing will happen. Finally, from our side, if you want to incorporate anything into the system, we want to the extent possible as an open system, which can be used, reused, expandable, with all features for identification, tracking, and duplication avoiding. If you are able to bring any solution, we can fit into any program, and definitely it will be a way forward. Thank you very much for the opportunity. Thank you.